Okay, let us know when you're ready, and we'll go ahead and get started within about a minute.
Stands taller. Yep. There you go.
Give it a little bit of leverage. All right, let's go ahead and begin. First of all, thank you. Just do a couple of housekeeping items here, and then we'll turn it over to the real pros here. But, got that. We will have some video and some photography from New York on site, so we'll share that afterward, and I'll send that. I'll basically email that out to you. We would have loved to have had our whole 100-member team here. Unfortunately, because of social distancing and the times that we're in, we were not able to have them all here. So we do have 4 caregivers who traveled to New York with the team and participated in the delivery of care at the hospitals there. But hopefully, as things move forward, at some point we'll be able to have some reunion with all of the caregivers who went there, who did a fantastic job. So to begin with today, we're going to have Dr. Paul Krakovitz, Intermountain Healthcare's Chief Medical Officer for Specialty Care. He's going to give us a quick overview and share some of his thoughts. And then we're going to go through the caregivers themselves. Dr. R.J. Bunnell, Dr. Dixie Harris, Whitney Hilton, nurse, and Dr. Harlan Hayes. And these folks represent different hospitals in different areas of the state who were part of the 2 care teams that went, totaling about 100 people. So Paul, if we're ready, let's move forward to you. Okay.
I'll take my 6 feet, Jess. Thanks. I stand here with incredible amount of pride that our team of 100 volunteers who went to New York City are back in Utah, and they're safe and they're healthy. I just want to start off by saying that as they've returned, we followed the CDC guidelines, and they've been tested, and thus far all of our caregivers are healthy and have tested negative. When they left about a month ago, we assembled 2 teams to go to New York. One was to go to Northwell Health, and the other went to New York Presbyterian. And these teams represented 14 physicians, 57 nurses, nurse practitioners, PAs, respiratory therapists, pharmacists, and multiple other caregivers. And what they saw when they went to New York was something that we've never experienced in modern healthcare, which was healthcare system in incredible distress. The caregivers there were in distress, the physicians, the nurses, emotionally fatigued, physically fatigued, and patients that needed care. Most of these caregivers that went were from Utah and from multiple places throughout the state. We had representation from St. Pete, from St. George, from Cedar City, from Primary Children's, from Salt Lake County, from Weber County, and from Utah County. The patients in New York City, though, had no idea that these people had volunteered to go, and they'll never know that they were from Utah. Many of them won't. They'll never know that they left their families, gave this sacrifice, went to an unknown area, put their fears behind their heart, and gave everything they could to help the people of New York. Not only did they help the patients of New York, they also helped give the energy much needed for the nurses and physicians of New York City to regain their strength to care for their patients. Now here in Utah, we've gained significantly from our caregivers volunteering to go do this work. The innovation and the creativity that they learned from the hospital systems in New York City will help us significantly in taking care of patients with COVID-19, but they'll also help us in caring for all patients with other diseases. We always learn when we go and do new experiences. So I would just like to say one more time, thank you, thank you, thank you to our volunteers who went and who put their pride and they put their self-respect in front of them, and they put their families and kept everybody in great health. I'd like to thank the City of New York for being so welcoming to our caregivers, and I'd really like to thank the state of Utah for understanding. I have incredible amount of pride for what you guys have done. I'm so glad you're back with your families, that you're safe, that you're healthy, and we're thrilled that you are Intermountain. So with that, I'd like to hand this over to Dr. Bennell.
Hey, thanks, Paul. I'm incredibly proud to be part of Intermountain right now. The opportunity that I had to be part of this team and to see through leadership's vision of doing some type of crisis response work in New York was just the opportunity of a lifetime. And I was just really blessed with an incredible 50-member team that put other people first at increased risk to themselves. And I'm just really proud of them. And happy Nurses Day, everybody, especially Whitney. Just want to tell you a little bit about New York City from my experience. So we landed in a New York that was eerily quiet. The airport was deserted, the stores were shuttered, and places that are normally incredibly busy, like Fifth Avenue, was just deserted for miles. It was really remarkable. We saw some really hard things in New York City, and these hard things were happening in places like Long Island Jewish, which is, really suburban. It's not just the big city being affected by this disease. So this was a hospital. We got there right at the tail end of their peak, and they had already discharged over 1,000 patients with COVID-19. Unfortunately, they had also had several hundred of these patients die just in the course of maybe a month or two. And just for perspective, we've had 56 patients die in Utah as of this morning when I checked. They had a hospitalist service of inpatient doctors like myself that normally treat 200 people. And when we got there, they were still taking care of 590 patients. And there were ICUs that were created all over the hospital. They had started with one, and they had to build 6 new ones to take care of all of these critically ill patients, a lot of whom will unfortunately not make it. So in the midst of all this, we were able to witness some incredible bravery and resilience. We saw caregivers that had taken one day off in 6 weeks. We saw a community and a hospital system that rallied around their doctors, nurses, and therapists. Every day when I would walk into the hospital, there were these handmade signs of encouragement, saying God bless you, and other kind of uplifting messages. We had food delivered to our office every day. I went down to New York Presbyterian one afternoon to see the cheer that happened at 7 p.m. in downtown Manhattan, and it was just a remarkable experience. So there were 4 or 5 fire trucks and their whole crews that set up outside, and right at 7 o'clock there was this raucous cheer that just filled the streets. People were waving flags and banners off of the apartment buildings. There were just people lining the streets cheering on these caregivers who were putting themselves at risk to take care of these COVID patients. And it was really uplifting to just be there, out of uniform, and just get the chance to cheer for my fellow healthcare workers. We also it was a really moving experience, and I think what I would like to kind of finish with is just calling out a couple of things that I've heard circulate recently. I want to make it clear that we're not dealing with the flu, that the hospital where I worked has handled flu season year after year with 20 ICU beds, and this year they needed 170. The coronavirus has killed more people in New York City over the last 2 months than it did in the previous 5 years of influenza without any type of measures being taken. So I know that it's scary at times, and it's hard to follow the different numbers and predictions that are coming out. And I think that's natural with a new disease and with human behavior. It's hard to model these things. But I just, we all need to be flexible. We all need to look for ways to help. And I'm sure that we're going to get through this just fine. I know that Intermountain is going to be prepared. There was so much that we learned when we were in New York. We have such great systems here, and we have such incredible systems in place to provide care. So I'm confident that we can get through this together. And with that, I'll give the time to Whitney. Or Dixie. Okay.
Hi. So, I think that what RJ said was very apt as far as our experience. What I thought I would do is just kind of convey what I saw. I'm an ICU physician, and so when I talked to my colleague who was going to put me to work, I said, you put me where you want me, where I can do the most and where I can be the most help. So I was assigned to Southside Hospital, which is a small community hospital in the middle of Long Island. So the community kind of looks like maybe like Mill Creek area, beautiful little houses, something that you guys would recognize. It's not the big Manhattan tall buildings. This is a community hospital. This hospital had about 14 medical ICU beds, and at its peak went to 150 ICU beds. It's like you've invited 15 or expecting 15 people for dinner, and you have 100 people show up. And you can imagine the logistics of what this hospital had to handle. What I saw was workers working day and night. Most workers told me they couldn't remember the last day they had off. I met a person who stocked supplies, because that was a big thing, and he said typically he worked 16 hours because there wasn't enough people to stock. The other thing I saw was some of the people who worked at the hospital, everything from the maintenance to environmental services to the nurses and even the doctors, they also had gotten sick. And many of them were actually coming back, and it was like, oh, you're back, glad to see you back, because they've been out for 14 days or more. So that's what I saw. I walked into a hospital that had been virtually overrun with patients, and what Governor Cuomo says he calls New York strong is the strongest group of people I've ever seen. And they were persistent, they were focused, and they were doing the job that they needed to do for their community. I also need to highlight the fact that these workers were taking care of their own. They were not only taking care of their own employees, and they did that, but they were also taking care of their own relatives. One situation in particular I remember, when you're in the ICU, you also cover the other units. If patients are going downhill, they're getting into distress, you will then respond to the codes, respond to what we call the rapid responses. And you'd hear them called overhead. So at one ICU I was covering, and I covered multiple ICUs through the time I was there, one of the head nurses had a relative on this certain floor, like say 6th floor. And every time they called, and it was very common because patients were very sick, they would call a rapid response to the 6th floor, she's like, her heart would stop because she had a relative up on that floor. And it really drove it home how horrific this disease is and how cruel this disease can be. Now, many people, a high percentage, don't have to go to the hospital. But those who end up going to the hospital with this disease, it's very serious and can be fatal. So I have a lot of respect for this disease. When you are sick enough to come to the hospital, it can be very cruel. I will highlight the fact that we could not have family members in the ICUs. And so it was also a very lonely disease because patients were there, we're all masked, gowned, and had different personal protective equipment, but they didn't have their loved ones at the side. So it was very hard to help take care of these patients. Because I was the ICU doctor and covering lots of ICUs, I would have to go around to different floors. And I want to highlight what Intermountain did. By sending a team of highly skilled, consistently skilled, equally skilled, talking the same language providers of nurses, respiratory therapists, you brought a whole team of the equal people coming in, and they were able to deploy us to all parts of the hospital. So when I went to the other parts of the hospital, and you can hardly recognize anybody because everybody's got their mask on, I'd say, oh, I'm here to find one of our Intermountain nurses or Intermountain respiratory therapists, and the staff there would automatically say every time, oh my goodness, the Intermountain people are so great. We love having them here. Thank you for sending them. So it wasn't just one-on-one, it was the whole team. And by doing this whole team, I think we created more good. It was multiplied what we were able to do. And I was at the Northwell system, and this is what I heard very consistently. At the very end, the CEO for Northwell came to our hotel to thank us because I was in the first deployment team, so we went to work for Northwell. The CEO came and said, thank you for arriving. He actually, when the surge hit and it was hitting the hospitals, we heard stories about, okay, this emergency room has 50 people coming in a 4-hour period, and it trickled through the whole area, all their hospitals, in like a week and a half. The CEO started getting on the phone, I need help. And what he said was the only CEO in the country said, I will send a team out to help, was Dr. Mark Harrison. And he said, I will help you. We were very fortunate because we haven't had a huge surge. We have patients, be very real, we have patients here that are very sick, but we were able to release people to go. So the people that were remarkable were the people that logistically got us there, the people that were back behind that backfilled our work, because we couldn't go there without the people in Utah doing the work and supporting us, our friends and families who supported us. So what I want to do, the last thing I want to say is thank you, Intermountain, for doing this. Thank you, Mark Harrison, for answering the call. Thank you, people of Utah, for supporting us. Thank you to everybody. I even had messages from my massage therapist thanking me for coming. Thank you guys for allowing us to go help these people who are our countrymen and help them in their time of crisis. And that's all I have to say. Thank you. And I wanted to say Whitney's going to come up and tell her story. Don't want to leave my mask.
Hi everyone, I'm Whitney Hilton. I've been a nurse for 7 years, and I too just want to thank Intermountain for this incredible opportunity. We say it's an opportunity of a lifetime, and that is, it was indescribable, honestly. It was the most shocking and rewarding, hard experience of my life, and something I'll never forget. I also want to thank Northwell, the company we worked for. I worked at Long Island Jewish Medical Center, and Northwell could not have been more grateful and welcoming for us. They felt that Intermountain came to save them when they were drowning, and they genuinely could not have been more appreciative of us for coming. And it wasn't just the administration, it was every nurse I met genuinely thanked me for coming, and the doctors too. They felt like they were yearning for help and that some other state in America came to help them. And I speak in behalf of all of us nurses and our team. We felt that, and all the travel nurses that were there too were, really making a difference. People ask me why I decided to do this, and to be honest, I've always been in love with New York City. I think ever since 9/11, they had such a unity there, and this was the same experience. This was us coming there to save them, and the unity was unlike any other you've ever seen in your life. It was teams of firemen and policemen showing up at the hospitals every day at 7 p.m. during shift change to clap for you. It was like apartment buildings screaming to be so grateful for everyone. And we were there 7 weeks later, so they're still doing this every single day. They never miss it. So that was incredible to see. So entering the hospital, people are like, what was that like? One nurse from Brooklyn described it perfectly, so I'm just going to use her words. But she said it was like throwing ice cubes at an inferno. I think when we arrived, we actually had some hoses, but it was still a burning building. And in an ICU setting, these patients have been there for so long that they're overwhelmed with patients. And I've never seen what I keep describing as a modern war. We're the same type of people, we're modern people, and there's modern appliances, but never have I seen patients lined up next to each other, and just the overwhelming feeling that this disease caused. The hospital system was able to adapt literally minute by minute to what was happening in front of our eyes, and that was nothing short of amazing. There was new structured intensive care units that weren't like this before the pandemic hit. So a PACU, an OR, a cath lab, a short stay unit, all sorts of kind of places that normally wouldn't have ICU patients were now housing people of the dozens. And so you can imagine that that was very shocking to someone coming from Utah, where we have complete structure. The one thing that was very, very difficult, the shock of that, seeing patients lined up to each other, eventually does fade away. But what didn't fade away was no one can prepare you for the death that you see. We would hear, like the other people have said, 20 to 30 code blues or rapid responses, code anesthesia a day. The amount of death that we saw was incredible. It was sobering, but the teamwork was amazing. I mean, people were really willing to sacrifice whatever they needed to save people as much as they could. And sometimes we weren't able to save people, sometimes twice a day, is what I saw. And it was difficult. These people do not have family, and I don't know that anyone's ever realized how big of a deal that is. A family member dying without anyone, and at times I wasn't even sure what the patient's name was because it wasn't my patient, I was just helping. But you hold the patient's hand, because you think to yourself, geez, if this was my mom or dad or sister or brother or friend, would I hope someone held their hand as they passed away. We would try to get on an iPad and have the family call so they could say goodbye. And I don't know that there's a dry eye in the room when that happened. There was one patient, back up. As far as the nursing care, I think I got a different perspective than some of my colleagues here today. The nursing care this was probably the first time in my life. I respect doctors so much, but this was the first time in my life where I feel like it came down to the nursing care on the patient's ability to survive. Nurses were so overwhelmed, and that's just what the disease did. They were given patient ratios that we normally wouldn't be given in a pandemic. And so you really can only focus on what's most important, which you can assume is keeping that patient alive. that was very difficult for a Utah nurse to jump into and let go of all these extra things that we do for patients that do matter. There was one patient that I will forever remember. I walked into his room on the first day. He was a middle-aged man, and on the wall in his room was a picture of him and his wife and kids and grandson. And throughout the day and the next shift, I went back and I looked at those pictures and I'm like, wow, yeah, he's a father, he's a husband, he has grandkids. And then, day 3, day 4, I was like, I'm gonna go check on him. How's he doing? And, I started realizing that everyone around me, the nurses, actually cared about him too. And, I really sat down one day when I had a second and thought, what was the difference in this one patient? And what it was the humanity. We still were reminded when we walked into his room every day that he was a person and that these people want him back and that he deserves that. And so here at Intermountain, I'm proud to say that I feel like we have every capability to do that, to remember the humanity in patients, and we will do it, and we were blessed with the opportunity to have time to prepare for that. And I think it's just as important as keeping the patient alive, honestly. I think we will be able to break down the nursing care into teams so that nothing gets missed and everything gets done and the patient gets the best care they deserve. I want to lastly say that the New York City nurses and doctors, and respiratory therapists and pharmacists and everyone on our team, those teams there are the true heroes in the story. They were the ones doing this, and they're still doing this as I talk to you. I'm so proud of our team. We became best friends in a matter of 24 hours, and then we'll stay friends for the rest of our lives. I'll just add at the end, I don't know if you guys have heard of Taylor Swift, but she got a hold of this story through my best friend, and she cares about New York City. She lives there. And, it's so cool, and I want to profess how grateful I am for that opportunity that she recognized me of all people. But I think it's also equally important that she actually believes how important it is to slow the spread of this disease, and how cool is that she'd use her voice to make that known. So here's her letter to me. Just paraphrases that she's just proud of me and would love to give me a hug one day to say thank you. And she just genuinely admires healthcare workers for doing what they're doing on the front line. And in the words of Taylor Swift, soon it will get better. Thank you.
Thank you, Whitney. My name is Harland Hayes. I'm an emergency physician in the Salt Lake Valley and up at the Ogden Hospital, McKay-Dee Hospital. And I echo everything that has been said. And the praise for the hospitals, the praise for Intermountain Healthcare cannot be overstated. This was miraculous, how quickly this came together. And it was miraculous at how effectively we were deployed. And I think that is a tremendous credit to the leadership of Intermountain and to the leadership of Northwell and New York Presbyterian Health Systems. Whitney is right, by the way, that I don't know why it took her 7 years to realize that nurses keep patients alive, not doctors. That is absolutely true. We rely on tremendous nurses and respiratory therapists and other staff members to really provide fantastic care for patients. Everyone on this planet watched as New York City was engulfed by this wildfire of a virus, and our hearts broke collectively. And it was not easy to look at and to watch from a distance. And the number of people that were eager to stand up and to step forth and to go and serve was overwhelming. Intermountain could have fielded 7 teams. They could field more tomorrow. It was really hard to see this kind of suffering in New York City. And it was incredibly meaningful to step foot in the hospitals and to care for patients. They used different computer systems than we do in the hospital. They had different floor plans. There were some different policies and different procedures. I got lost in the hospital a couple of times. But remarkably, when you sit down at the bedside of a patient to care for them, those differences go away. And when you discuss with your professional colleagues there data and literature and treatment strategies, you are speaking a common language. And there's an instant bond, and it was beautiful to be a part of that. One story that I'd like to share, most of the patients we cared for in the emergency department and throughout the hospital were these patients infected with coronavirus. And as you know, as they get sicker and sicker, they progress towards intubation and requiring ventilators and spending time in the intensive care units. And that's a sign of severe disease. We had one such patient in the emergency department, a woman in her 40s, that was slowly decompensating and that required intubation. And as we finished that procedure, there was a cry for help. There was a young woman that was being brought into one of the ambulance bays who was actively in labor, and things were progressing fast enough that she would not have time to make it to labor and delivery. And this team of Intermountain and New York Presbyterian nurses that came together, that gathered supplies, that found a baby warmer, that found suctioning, that held the patient's hand, that started IVs as I was able to deliver this baby. It was remarkable. No woman dreams of delivering a baby in the emergency department in New York City during a pandemic. But as it became apparent that this mother and this baby were going to do very well, the stress and the tension in the room gave way to congratulations and to smiles and to laughter and to tears of joy as this baby boy was laid on his mother's chest and as things went well. And it was amazing to watch her, after a few minutes, taken through the hallways to eventually go up to the postpartum area, and to see these healthcare workers who had been beat down by death and by illness and by overwhelming numbers, to watch these smiles on their faces appear and have them applaud this woman as she left the emergency department. And it reminded me, and I think this story is an excellent illustration of life and joy during a time of difficulty. I don't know that our society has faced anything this difficult for generations. And we have not asked this kind of sacrifice of students and of parents and of teachers and of business owners and of healthcare workers. It's unprecedented. Yet, I think that as a society and as Utah, we can be confident that we can be resilient. We can find ways to smile. We can find ways to connect with people. We can be patient. We can follow the recommendations of our epidemiologists and of our scientists who are asking us to patiently wait things out and patiently return to normal in a very structured, careful way. There are experts in this field, and I would just ask us as a community to trust them. And we are going to do well, and we're going to look back on this someday. We're going to be grateful for the sacrifice of everyone, not just the healthcare workers, but the parents and the teachers and the government officials. And I think we can be optimistic. But I too would like to thank Intermountain Healthcare and its leadership for recognizing a need and for putting forth the work to send their caregivers to New York. This was a remarkable group of people, and I was honored to be part of it. Thank you. Yeah, I think that we all wish that we had a crystal ball. right? We all wish more than anything that we could deal with this uncertainty and that we could know exactly which steps would lead to which outcomes. We do know that careful social distancing inhibits the transmission of this disease. And so I mean, my opinion is that I will put my trust in the experts who set the pace for us. And there are many, many brilliant scientists who are trying to model the way that these curves will play out and the types of effects that different social measures will have. And it is, I think it's imperative that we avoid coming to our own individual conclusions. I think everyone ought to read up on this disease, and everybody ought to read up on whatever science they can. But let's continue to band together. Let's continue to patiently follow the guidelines of experts here. I see communities and we see some groups who are moving too quickly, and I think in a few weeks, sadly, we are going to see the consequences of that. But I think we have excellent leadership in the health systems in the state, and I know that our government officials are being counseled by these officials. So let's keep doing what we're doing, and I think we'll be okay.
Any other questions?
Can you describe specifically some of the things that you learned in New York that you would put in place here in responding to COVID?
I'll take this one. So, when you have the opportunity to see a high concentration of a disease, you not only learn the typical components of what's happening with the coronavirus, but also you learn to recognize the unusual cases. And when you have the concentration, you can then understand what is working, what is not working. The most important thing that we learned, and it's kind of alluded to in Whitney's talk, is the basics of healthcare. Our safety, our culture, our training, and the nurses is the number one thing. The safety things we implement and not taking shortcuts. Now, when you're in the situation that New York had, where you're overrun, sometimes you didn't have time to implement all the safety measures. Here we learned why, when we saw what we saw there, we learned exactly why we need to do second checks on medications. We learned why we need to turn patients. We learned that one of the biggest things we learned was that having patients prone, laying their stomach, even patients up on the medical floor, not waiting for them to land in the ICU, so super sick on the ventilators. Let's see what we can do preventative. In New York, as in here, we have studies going on about treatments. We have studies going on medications that can mitigate the inflammatory effects of the disease. It's still early. We're learning, and you have to do this scientifically, but the things we did learn is very clearly the safety measures we do, the quality, the proning. I think those are the key things, and also really highlighting, I saw it in a community not much different than here. This disease can spread like wildfire, so let's respect it. And again, not a high percentage gets sick, but when patients do get sick with this, they get very sick. So we're learning what group of patients tend to get sick, but be very real. Every one of us saw somebody in their 20s. So it's, people think, oh, I'm in my 20s, I'm safe. No, I saw patients die in their 20s. So we have to respect this disease. We're learning from this disease. We don't want to jump onto therapies before they're actually shown to work scientifically. And that's why you hear like the experts nationally saying, we're going to do these studies, find out. And I think we have, 6 to 10 randomized controlled trials that we're doing actually here in Utah. And we're doing some of these in conjunction with the University of Utah. Most of these studies are doing nationally. So again, we saw different medications coming through early on, and then even as we were there, we saw that the practice patterns changed. So This is a disease we're all learning from. I'm very humbled by this disease. And I do think in the end, we will know how to best take care of our patients, but we're still learning. Any other questions regarding that?
Okay, any other questions at all? Okay, everybody, thank you so much. We will be emailing photos and video links as well. Appreciate your support and
I just close out one. So before we go, the stories of humanism here are incredible. Delivering a baby, Taylor Swift, the fact that these people just got up and went is just so incredible. And this is really what the core of caring's all about, and it's the best in what's in all of us. So I just want to say one more time, thank you guys so much for doing this, and thank you for taking care of everybody here in Intermountain.
That's